we're going to Medical Towers Makati to visit the dentist we're going to interview today.
I'm a dentist for almost 2 years. I'm working at Palma Dental Clinic. Here's our clinic. We operated, I think, more than 20 years from now. Then we cater all kinds of patients, and we also do all the dental procedures.
First question is, who are the target customers of your clinic?
Target customers, as what I have said earlier, we cater all kinds of patients. Usually, we cater almost all health cards. So, health cards, like Elisier, Medicard, like those of those cards. There, we cater all kinds of patients. Also, internationally.
Is the location easily accessible to the client?
Yes, I think so. Because we're in Ayala, almost all of the people know this
building.
Yes, and this building also.
What are the professional standards required in selecting or hiring staff?
Any requirements? I think a person should have a professional experience also as well. So, for me, for example, before working here, I worked before in Las Piñas, so I do have a good months of experience on interviews. And for the secretary and the assistant, our secretary here, Miss Edna, is already working for almost 20 years.
Welcome to Surgery Squad's virtual erupted wisdom tooth extraction. I'm Dr. Jeff, and I'll be walking you through this procedure today. A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars, commonly known as wisdom teeth. Most of us have to have our wisdom teeth removed due to chronic pain or discomfort, periodontal disease, or an increased risk of damage to the adjacent teeth. Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems. Our patient today is having their lower right wisdom tooth removed, or, as a dental professional may refer to it as, tooth number 32. Before we begin, let's get some x-rays taken of our patient's teeth. X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities. Let's get started. First, insert a positioner into the patient's mouth. Next, position the X-ray cylinder where indicated. With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to, and take the picture. Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure. I couldn't have done it better myself. I'll have my assistant finish up the rest of the X-rays, and then we'll view the resulting images. Well, everything appears to be normal with the wisdom tooth's roots. And now that all of the X-rays have been completed, we can extract our patient's wisdom tooth. The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth. Patients that have 2 or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic. To begin, you'll need to apply a topical numbing gel to the anesthetic injection site. This will help decrease any pain the needle may cause. Next, we can inject the local anesthetic. The patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours. And now we'll give our patient a few minutes to become completely numb. Great, the patient's mouth is numb, and now we can move on to removing the wisdom tooth. First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator. Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed. Now clean the area using a surgical suction. This will allow us to check the area for any bony matter or tooth structure that may be left in the socket. Everything looks great, but we're not done yet. Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot. Since the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth. When getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds. The rate of your recovery depends on a number of factors, including the complexity of the extraction, your age, and your individual recovery capacity. Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday. After the surgery, the oral surgeon or dentist will provide some information tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the first 24 hours to reduce swelling, refraining from physical activity for the first few days, avoiding sodas and the use of a straw, and gently rinsing your mouth out with warm salt water to help relieve pain after the first 24 hours. It's also suggested that patients do not smoke for at least 24 hours after their surgery. Smoking may not only delay healing, but it will also reduce the blood supply and could introduce germs and contaminants to the surgery area. And that's a wisdom tooth extraction. You did great!
So, parang sa lahat po, ano po talaga yung pinaka-major problems or challenges na ina-encounter niyo?
As a dentist?
Yes.
Or here sa clinic?
Dito sa clinic. With a customer.
Usually, like what I've said, we cater almost all of the health cards. So, yung, for example, telecare patient, tatawag yun by phone, magpapaschedule, magtatanong, pag nandun na ba ako na ba agad yung gagawa? Siyempre, hindi namin masasabi yun. Kasi pwede may patient before her or him na pwedeng may ginagawa pa. For example, malilengthen yung time. Hindi mo naman may iwasan hindi mag-antay, di ba? Lalo pag na-late yung patient.
Yung before na patient.
Oo, malilate yung before na patient.
Sunod-sunod na.
Urong na. So, parang domino effect na talaga siya. Yun. Tapos, another one din is, kasi yung mga health card patients, parang masasabi ko na sila pa yung demanding patients. Yun. Kasi, yun nga, like for example, yung sabi ko, gusto nila sila na agad yung nakasana. Tapos, basta pa, sila pa yung maraming gusto. Tapos, another one is, syempre, about sa price. Patients, like, they need discount. Usually kasi kami pag health cards, we give 20% discount. Tapos, yung remaining discount, for example, pag gusto ng patient ng 50, isipin mo muna, materials. Yung gamit mo dito. Syempre, yun, iniano mo yun. Kumbaga, yun lang naman, tsaka...
Factors para dun sa discount na ibibigay nyo.
Factors, depende. Inaano namin yung materials. Tapos, kung gaano kahirap yung procedure. Laboratory fees. Like, for example, yung mga dentures, papadala namin sa laboratory, sila ang gagawa. Siyempre, ita-charge nila kami. So, sinasama namin dito sa price.
So, Doktor, estimation na ng cost of extraction in this clinic?
Tooth extraction, we have a minimum amount of 1,000.
Minimum.
1,000.
And then the other ranges.
Depending upon the case of the tooth. Nagma-maximum kami up to 10,000 for wisdom tooth extractions, unerupted, mga impacted cases. We allot at least 30 minutes. 30 minutes per patient.
Per patient.
Siyempre, depende sa procedure na gagawin sa isang particular patient. Siyempre, for example, pag tooth extraction, wisdom tooth, mag-aalot ka na ng mga isang oras. Mga ganun. Root canal, 1 hour din. Yun.
So, what would you recommend your patients for a good oral hygiene?
Advice for my patients, first of all, syempre, brush your teeth 3 times a day, and then floss also regularly. After brushing, floss, kasi yung mga hindi natatanggal ng brush, yung floss na nagtatanggal. Like yung sa mga proximal contacts, yung mga singit-singit, yun. And then number 2, visit your dentist regularly, at least twice a year, every 6 months.
Twice a year. Okay, so with that, Doctora, we're going to conclude our interview, and we wish to have you as a dentist someday.
Sure.
More blessings and more power.
Thank you.
Thank you.